I'm Rayan. This is Balsam Medico training. Today we're going to start with the doctor role. As a doctor, your two main pages are the planner and my schedule. We'll get to the patient tab in a minute. So let's start with my schedule. As a doctor here, you can view your appointments of the day in this page. As you can see here, we have three shades. We have the red, we have the clear, and we have the gray. The red means that the clinic is out of working hours. The gray means the doctor is out of working hours. And the clear means that the clinic and the doctor are in their working hours right now. The day view will show you the view for the day. As here it's stated, it's on March 26th. This is the full list for March 26th. You can view the week to view your entire week's appointments. And if you'd like to see all your appointments since the start, you can click on list and have a view over here. You can search by a specific patient or filter by the appointment status. The canceled appointments will not be visible here. It will only be visible when click on the cancel appointments. It will show here if there is any. You can create your own appointment by the create appointment button, but we'll get to that in the receptionist training. Let's move to the planner. In the planner here, you'll see your upcoming visits. Let's hide this for a minute. You can see your upcoming visits here. You have an appointment at 8 p.m. and the next is at 9 p.m. You'll be able to view their information over here. You can see the patient's name, their basic information, and if there's any insurance in hand or not. You can also see their status of their appointment, which, for example, now we have scheduled and another patient that's waiting right now. Waiting is basically that the patient is now waiting in the waiting room of the clinic. On your right here, you can see that there's the statistics of the day. So it will show you the number of appointments you have in total and in specifics for each appointment status. For example, you have one now in scheduled and one in waiting. Once you've completed the visit, it will appear here in the today's appointment or completed appointments. To start the visit, you'll have to click on the Start Visit button over here. This will take you to your next page and the status of the appointment will be changed to in visit. Balsam Medico supports both dental and general medicine specializations. You will start with the dental, but you can skip ahead to the time slot shown on the screen for general medicine. Let's move on to the dental. As a dentist, you'll start the same way as clicking Start Visit. And this is what we call the current visit page. In here, you'll be able to handle everything that has to do with the patient in one page. In the middle here, we have the dental chart, and you can see down below is the treatment list, as there is no treatments right now added for our patient. So let's start by entering the charting mode. You have to add the information here, but before all of that, the first and initial step is to add the visit notes. So in here, you have the duration of illness, the chief complaint, and the visit clinical notes. You can choose here from the template shown. So every time you write something, it will automatically be saved for you, and you can use it in the future as a template. Chief complaint, we can use broken tooth and gum bleeding. Visit clinical notes, you can choose one from here and edit as needed. As an example, once I've added all my information here, the system will automatically save this data and it can be used in the future as a template. Now let's start with the most important thing, which is adding teeth conditions to the dental chart. You'll enter the charting mode, click on the tooth desired, and select one of these tooth conditions. We have missing, caries, simple, and presurface. We also have fracture, simple or root fracture, pulpitis, for example, click that one. We have lesion, and we have others such as cervical lesion, add a watch, or custom text. For now, let's add the lesion and a caries per surface. As you can see here, the severity ranges from 1, the lowest, and 2, 3, and S, which is the highest. To add the severity, just click on the surface. You can double click to add the severity. For fracture, we can click on fracture simple or root fracture, for example. Once you've added all your teeth conditions, you can click on the tooth required and you can add a treatment. So the treatments are here categorized by their groups. If you'd like a specific group, for example, your filling, these are all your filling treatments here. The treatment will show with the CDT code, the full name, and the pricing. If the patient has any insurance, it will show you here if it's covered or not. Right now, let's choose one of them. Let's go composite into surfaces. So you can choose your surfaces over here and add your diagnosis. So you can manage your favorites. You can click on here, choose your favorite diagnoses, and click the star to have it saved as favorite. Your favorite will always show here, but we can always choose one here. As an example, I have chosen reversible pulpitis. Next, we'll choose the status. We have three status here. There is the current, which are treatments you're going to start right now. Recommended, which are for future planning. Existing are treatments that were done to the patient by another provider. As of right now, let's start with the current and click on start treatment. You'll notice that the tooth has now the color blue. You can exit the charting mode, and down below here you can see that there's the current treatment with my name and the date of when it started. You can add as many treatments as you'd like, and we'll move on to the next step. Click on the treatment, and here you'll see your progress notes page. On the left here, you'll see the CDT code here, the treatment's full name, and when it was created. The name of the patient, the name of the doctor, and the status over here. The other information will also be visible. If you would like to add any progress notes, you can just click on here and start. I'll start by, for example, saying, this is an example, it's not the actual note, but as a dentist, you'll be more aware of what to write. You can add all your progress notes, and once you're done, click on Add Note, and finally, Save Treatment. As long as the treatment is in the current list, you can add as many progress notes as you need. But once you've changed the treatments to completed, you will no longer be able to add any progress notes. To change the treatment to completed, you'll go here to the treatment itself, click on the treatment status, and click completed. As you'll notice now that the field to write any progress notes is now removed. Click Save Treatment, and now the treatment is under the completed list. Once the treatment section is done, we can jump to other parts. You can view the visit notes by clicking here. You'll see all the visit notes that were added. These are the ones we added moments ago, and you can view them now. We can now jump to the prescriptions. To prescribe a drug, you'll have to click on prescriptions, add prescription, and choose from either the commonly used prescriptions over here, or click on add drug, choose the drug of your choice. For example, make sure to choose the correct strength and dosage form. For example, here I'm going to choose the 200 milligrams powder for suspension, or the amoxicillin 125 milligrams tablets. Select the drug, add the information here, route of admin, duration. You can also choose the default frequency. So it's a two pills, two tablets every 8 hours, which gives you a total of 42 tablets in the 7-day duration. If you have any more instructions, you can write them here or choose from the meal restrictions. Click Save finally, and you'll be able to see them over here. Now, once you've clicked and added all your prescriptions, you can now add them to the prescription here. So this is the drug we just added right now. If you can add as many as you need in one prescription, and you can alter their information. So for example, here, let's just change these to milligram, change the root, and finally, when you're all done, click on print and look, and the prescription is now saved with your clinic logo, information, patient information, and everything needed here. As a doctor, your signature and stamp will automatically appear here, and then you can either print or send it to your patient however you want. To view all the prescriptions you have made for the patient, you'll find it in the same page here. It will give you a full list of all the prescriptions if there's any. Next, let's move to the patient files. In here, you can add any. In here, you can add the patient files, including x-rays, lab results, pictures before and after case photos, all that. Just simply click on add one or more files and add the information and or the PDF that you want. Next is the vitals, which is one of the most important things. For every visit, you'll have to add the vitals for the patient. Click on record vital readings and add the information here. An important note is that the vitals should be always added when the visit is in visit status, which basically means when the patient is inside. Add the vitals. And the BMI will be automatically calculated for you. Click on Add Reading, and here you can view all the previous vitals recordings you've made for the patient. Click on Dismiss, and let's move to the next. Down here below, you can see that there's the visit diagnosis. We've added the diagnosis with the treatment, which is now given the primary tag. Once you add more diagnosis, the first one will be given the primary tag, while the others will be given the secondary. You can click on Change Primary to change the primary tag for any diagnosis. Patient History. To add any history to the patient, click on Edit History, and you'll be able to view them here. One way we would like to explain the patient history is that it's made in 3 sections. Section 1 is the medical alerts. These alerts will show above the dental chart in red. For example, if the patient has thyroid, or if there's any that's not available in this list, you can just write them down. For example, prediabetes. Click on Save, and you'll notice that it's in red over here called Patient Medical Alerts. Next, we have the patient problems and the allergies. Click on Add Patient Problem, choose the diagnosis that we've already added previously, and add the problem with it. Choose the life cycle, and if possible, the onset and the resolution dates. We click Save. To add the allergies, click on Allergies here, and choose the allergy type. If the patient does not have any known allergies, you'll have to click on Others. Choose here No Non-Allergy. You can keep it as simple as this or choose the specific allergy that the patient has. Finally, click Save. The last part of the medical history is the medical history form that has the medical history and the dental history. This part is fully customizable. You can either give us your list and we can add it here for you, or you can use the default form over here. Add the information you need, and finally click on save. And now you finished the edit history. The last step you can do is schedule a follow-up. So before you'll have to go to the receptionist to schedule a follow-up for the patient. However, now to reduce the unnecessary communication, we've added the schedule follow-up where you can choose the day and the receptionist can continue the process from their side. So you can either click on tomorrow, next week, next month, or a specific date. And finally, click on finish visit. The current visit has a lot more, but we'll keep all of that for the next visit or the next training, which could be training level 2. Finally, click on finish visit, and it will take you back to the planner. Once you finish your visit, you'll notice that it's appearing here now in the today's of completed appointments. You can open the visit again to have a look at it, but we advise not to change anything after that. Now let's move to the general specialization. It starts the same with the start visit, and you can see that the view is a bit different. You can now see that the view is a bit different, but it still goes the same way. Number one, you'll have to add the duration of illness, chief complaint, and visit clinical notes. So let's say here, for example, 4 days. Once you write anything, this system will automatically save it for you. And you can use it next time. And you can use it next time in your future visits. Next, you can add the diagnosis. Click on Add Diagnosis and choose the diagnosis using the ICD-10 codes here. The first diagnosis you add will automatically be given the primary tag, but you can add another one, for example, and the second one will be given the secondary tag. However, if you want to change, click on Change Primary, choose the one you desire, and now it's given the primary tag. You can add the treatments over here by click on Add New Treatment and add the treatment that you need. For example, mole remover, and you can choose the status. So we have 3 statuses. First one is the current, which are treatments that you're going to be performing right now. Recommended, which are for future planning. And existing are ones performed by another provider. For now, let's click on current and click on add and start treatment. You'll notice that the treatment is now given the color blue and it's under the current list. Click on it and you can add your progress notes over here. You can add as many progress notes as you need. And as long as the treatment is under current, you can add all the progress notes. So let's say, for example, this is just an example. And once you're done, you can click on Add Note. Add as many progress notes as you need and click on Save Treatment. Once you've added here, you can now change the treatment to completed if you're done with this treatment. To do that, click on the treatment. You'll notice here in the treatment status that there's the current, and then click on completed. And once it's completed, you'll notice that the progress notes field is now not available. So finally, click Save Treatment, and now the treatment is under the completed list. Next, let's move to the patient history. Click on Edit Patient History, and we would like to explain the patient history that it's divided into 2 sections. Section 1 is the medical alerts, which will be then shown in red coloring, and the second is the medical form. So for the medical alerts, you can choose one from the list provided here, or write your desired one. Click on Save, and you'll notice that now it's in red over here. Section 2, which is very customizable, is the clinic's medical form. So you can provide this with the one you want, or we can provide you with a default list. Add the information you need, and finally click on Save. Next is the vitals. For every visit, you should record the vitals for the patient. To record, click on Record Vital Readings, and you'll notice that the vitals can only be added for appointments with in-visit status, such as the status we're in right now. You'll add the vitals here, and the BMI is automatically calculated for you. Finally, click on Add Reading, and it will be shown here. You can click on View All Readings to view the full list of all the vitals added for this patient. Next, we have the problems. To add the problem, click on Add Problem. Choose the diagnosis that you've already chose. Add the problems and add the life cycle. Finally, add the onset and the resolution date if there is any. And finally, click Save. To view all the problems, click on View All, and you can see the full list of all the problems for this patient. Next is the allergies. If the patient has any allergy, click on Add Allergy and choose the allergy type. If the patient does not have any known allergies right now, click on Other and choose No Non-Allergy. Finally, click Save, and now the allergies have been added. And click on View All to view the full list of the patient's allergies. Finally, we have the medication. You can add the medication from here, or you can add it in the same page as the prescriptions. Let's move to the left side. On the left side here, you can see that there's the visit notes, which will show you a full list of all the visit notes added. In the patient files, you can add all the patient files here, including lab results, x-rays, and case photos. Simply click on Add one or more files and add the document or the file that you want. Prescriptions. To add a prescription, you'll notice that once you click on prescriptions, it will show a full list of all the prescriptions given to this patient. You can add a medication or you can add a prescription here. To add a prescription, click on the button. You can choose from the commonly used drugs list here, or if it's missing from here, you can click on Add Drug. Choose the drug of your choice. For example, sodium chloride 3%, solution for infusion. Make sure you're choosing the correct strength and the dosage form. Click on Select Drug and add the rest of the information. Add the strength, route of admin, the default duration. You can also choose the default frequency. Choose the dose. Choose the default dose, and it will automatically calculate the total amount. You can also add any default instructions or choose from the meal and time restrictions. Finally, click on Save, and you'll notice that the drug we added right now is over here. You can choose this drug and add any other drug to the prescription as you want. Make sure you choose all the correct information. And finally, when you're done, click on Print and Lock. And the prescription is now printed with the clinic logo, the clinic information, patient information, and the drugs. As a doctor, your signature and stamp will appear here. This prescription can now be downloaded or printed accepted and given to the patient. Once you close, you can see now you can see that the prescription you've created is right here. You can click on revoke or you can print it again. Finally, you can schedule a follow-up. Normally, you'll have to go with the patient to the reception so you can schedule another follow-up for this patient. To reduce the unnecessary communication, we have added the schedule follow-up over here. Click on the day, for example, tomorrow, next week, next month, or specific day, and the receptionist will handle the rest of the appointment creation. The current visit has other information and other tools, but we'll keep that to the next training. Finally, once you're done, click on Finish Visit. Click Yes, go to Planner, and it will take you back to the planner. Now that you've seen how it works, we encourage you to try it out and explore the features firsthand. Don't worry, there's still more to go, but let's keep that for training level 2 video. If you have any questions or need further assistance, our support team is always available and here to help you out. Feel free to reach us out via our customer support number. Thank you.